Welcome, everybody, to the 100-Year Lifestyle, where we are transforming health and longevity worldwide so that you and your loved ones can live at 100% for 100 years and beyond. And I have with us today a friend of mine, good friend, the medical director for HillDT Solutions, and Tim Burkhart. Dr. Tim Burkhart, welcome to the 100-Year Lifestyle.
Thank you. It's great to be here today.
Yes, it is. It's great to be together. And, we're going to blow some people's minds today who have arthritis. They were diagnosed with, oh, well, you have arthritis. There's nothing you can do about it. Or you got a disc injury. You need surgery, or we need to cut you, or whatever. There may be cases like that are out there, but so few compared to how many are diagnosed because of what you and I are doing and many of our colleagues are doing with non-surgical spinal decompression, the work that we're doing. So welcome to the 100-Year Lifestyle. And how'd you get into all this? Tell us about your background.
So I've been a chiropractor since 1984, treating thousands of patients. We tried to figure out not that long ago how many people I've treated, and it was crazy. I was just like, wow, I had no idea. But my
Dude,
personal
you
experience.
got me beat by a year. You're
Oh,
84, I'm
well,
85. You're 1 year
yeah, but you're
older.
so much better looking than me. That's the
But
key.
you have more hair.
Well, we're all in it together, Doc.
We are, I know.
But what started me down this pathway was I had a severe car accident where I had two herniated discs in my neck and one in my low back. And one of the local neurosurgeons was actually a friend of mine. And I went and got an MRI and I said, dude, I have to bend over patients. I have to care for patients. I have to move big guys around. Uh, I cannot have surgery. Like, that's not even an option for me. He goes, well, looking at the MRI. And I'm like, well, I need a solution. He goes, well, you call me when you're done chasing down whatever you think you're going to do. So I did a ton of research on spinal decompression. How do you correct a herniated disc? How do you prevent discs from disintegrating and deteriorating over time? I did a lot of research, and this was back in 2006. And having been in practice already for quite a while, I knew what adjustments could do. I know what exercise could do. I knew what nutrition could do, but I did not really have that paradigm shift yet on how you can regenerate a disc when it's already severely injured or starting to have a problem. And so in my research, I discovered the Hill DT table, which at the time had a different name. And Howard Hill, who owns Hill Laboratories, found out that I was researching all this, and then I had purchased a couple different tables trying to find the right product because if I'm going to treat me and it works for me, then I want to certainly do that with my patients, right? So that relationship developed with Howard Hill, and I ended up getting into the Hill tables. And then after that, I was asked to be involved in the clinical development of the protocols. And, it just kind of started from about 2007 on. And here we are today. We have clinics all over the world. We actually have tables in 6 continents right now. And it's kind of funny if you look at my Delta Sky miles, it kind of speaks to that. I'm closing in on 2 million miles with Delta, and that's a lot of time in a seat. But you know what? Overseas, doctors recognize that there's no evidence for surgery, there's no evidence for drugs, there's no evidence for injections. Those don't help. People need a real solution.
Well, I love what you're saying because we have forever, in my 40 years of practicing chiropractic, we have had so many people that had, oh, you got to have surgery, you need this, you need that, and we're like, no, you should try everything else first. Are you kidding me? That is the last resort, the absolute
Exactly.
last resort. And we've seen so many people. I mean, we have people that have had surgeries where they got 5 screws on each side of the low back going into the L1, 2, 3, 4, and 5 discs. And we have see people where they've got all these huge slices in their back and multiple shots and over again. And you think all of that, it's so radical. Like, to me, that's radical. And you should do everything conservative first. Try everything first, because the body's ability to heal itself is amazing if you just give it what it needs and you remove the interference, which is what happens with chiropractic adjustments and non-surgical spinal decompression. So, this is a new technology that we have implemented in our practice because of my son, Dr. Corey, and he got to know you, and you guys, he completely trusted you. And we're seeing amazing things. We're seeing literally discs regenerate, get bigger, space where it wasn't there, it's now there. We're seeing mobility where The neck didn't go backwards at all. There was no space on flexion and extension or forward and backward bending. And now there's big space on forward and backward bending and people getting back into their life. It's phenomenal stuff. And so give us some insights into, you say there's no evidence for really that surgery works long term. I mean, a lot of the people we see have had 2, 3, 4, 5 surgeries, and it's different than 2 and 3 and 4 and 5 adjustments that just make you feel better and are leaving this tissue intact.
Yeah, that's for sure.
Talk to us about some of the research that stands out to you.
Yeah, so there's a great book out there that talks about this. Surgery is the biggest placebo effect known. And here's what I know. If you look at the statistics and the studies, the leading cause of death post spinal fusion, guess what it is? Opioid overdose. Now, if you just start to wrap your head around that, you get to realize that this isn't about getting rid of somebody's back pain or helping their herniated disc recover. This is actually about saving lives. I mean, it's remarkable. And, you know, in the United States, most of the doctors that are doing this kind of work, like you and your son have taken on, it's mostly chiros, right? Chiropractors are discovering this, they're adding it to their practice. But overseas, the people that I work with there, guess who they are? They're neurosurgeons or orthopedic surgeons. They're these big medical practices that where overseas they recognize, well, if we do this and it helps the patient, then we don't have to do that because once we do the surgery, we know the patient's going to have ongoing pain and disability. So it's just ironic to me that here in the United States, we claim we have all this science and knowledge, but yet we actually deny the evidence that repeatedly shows us that chiropractic is the safest healthcare thing that you can do on the planet. And when you add decompression to it, it just makes so much sense because you're actually changing the physiology of the disc. You're making it regenerate, rehydrate. You're improving oxygenation and nutrient uptake. And there's tons of studies. I mean, I host a summit every year in Dallas where doctors come from all over the world. And we go over all those statistics, right? And the research to most people is kind of like, oh, okay, great, you proved your point. But I think it's important that people realize that when you put the medical side of the studies that show the efficacy of all these procedures that they claim help versus the chiropractic decompression side of the evidence that's out there, it's like medicine fails horribly because it just flat out doesn't work. And some studies actually say it's dangerous. One of the greatest compliments I've ever had was in Berlin about 2 years ago. I was presenting to a group of doctors. And before I even got up and said one thing, they had their local hospital radiologist get up and say, I don't know what this guy's about to tell you, but I can tell you based on pre and post MRIs that what they're doing is miraculous. It's unheard of. And what most of these surgical clinics are doing is, and their word, not mine, it's criminal. It's criminal what they're doing to spines.
It's interesting you use those words. Those are really big words, and I use those words a lot too, because I do feel like in a lot of ways, I mean, they're not necessarily bad people, but the protocols are bad in most cases. They're last resort done first resort, and nobody plans to be an addict. And what is often true, like you were saying, that people die from opioid addiction or they get hooked and it changes their life forever. They can never function again because of that. It's important for people listening to this to say, you know, if you have any of these things, arthritis, osteoarthritis, spinal arthritis, herniated disc, ruptured disc, back pain, whatever, you should go to a chiropractor first. And if that chiropractor doesn't work, go to a second or third and find the strategy, the technique, because there's different styles of chiropractic. And
Sure.
you know what I love about HillDT and you know, I love your tables obviously because we use them and we looked at a lot of different tables and we chose what you guys are doing. You have the science and you have the research and you have the protocols. And when you go and you get surgery, once you cut, you can't go back. You can't go back and change it. And you'll be amazed at what happens if you just give it a chance, to give the body a chance to regenerate, which you brought up the regeneration word. I want to bring it up again because from a 100-year lifestyle perspective, if you knew you were going to live to 80, 90, 100 years and beyond, how would you look at your healthcare choices differently today? Would you try, wouldn't you try everything possible to get your body to regenerate naturally and holistically rather than cut and have permanent scars in the tissue and permanent damage to the tissue? And so talk about, from a regenerative perspective, how does chiropractic care and non-surgical spinal decompression, from your perspective and a research perspective, contribute to regeneration?
That's a great question. I love talking about that because a lot of people don't think it's possible. Even doctors will say, well, once the disc is gone, it's gone. And that is not true. There are so many studies that show you can recover disc height. You can actually rehydrate discs. I have in my own practice MRIs, pre and post, that I show people, because how it works is as you lay on the table, and I'm referring to the HillDT table now, not the chiropractic table, as that distracts and creates that decompressive event over the series of cycles of treatments, it creates a vacuum effect inside the disc. And once that vacuum is created, it starts to draw in oxygen and nutrients and blood flow. And that's what the body needs to heal. If you just sit there with the disc not doing anything, it's never really going to be able to really fully realize its potential, right? And how the chiropractic adjustment helps is because you're moving those segments and you're releasing those facets that are locked, all the biomechanical disrelationships, or dysfunction, if you want to use that word, that are created because that disc height change, that herniation, creating pain to the surrounding tissue, has completely altered that joint function. So with chiropractic and decompression, that's the winning combo that, I often tease our providers overseas that don't have chiropractors in their country, right? And I go, well, if you just do the table, you're probably going to get 80, 85% improvement. And they love that, right? Because most surgeons are happy with 50% improvement a year later. But if you add chiropractic to decompression, now you're in the 90s. You're 91 to 95% success rate, depending on what the case is. So there's no question that the chiropractic element of the manual care of adjusting the spine or manipulation, whichever word you prefer, moving those segments and then decompressing the disc, that combo is what gets those results.
Yeah, and I'm actually gonna take an even different approach. And I love how you use your hands to describe it. So there's gonna be the audio podcast version of this, and then we're gonna have the video that we're gonna release on this. Here's how I say how it happens. So if the chiropractic adjustments, they move the bones forward and backwards, side to side, rotation, get it functioning properly. And then that takes pressure off the nerve and creates the function. And the decompression does this, where it
Correct.
really stretches it out and it pulls it apart, which does all the things that you just described. And in our practice, what I tell people, and this is true, 80% of the discs injuries before we got HillDT, they responded and they did really, really well. What the decompression did was it took it over the top, and actually where we started to see the regenerative disc heights changing, where it actually grew back. It started to get hydrated, like you said, where it starts to come back. So the combination, like you say, the winning combination, if you are a highly skilled clinician, chiropractor, doctor of chiropractic, if you are highly skilled at what you're doing, this will add so much next level function result, visible changes that will blow your mind. Like we have in just a short period of time, we have a guy who he's in his 70s, and his disc was just, I think it's his L4 disc is crushed, literally looks crushed. The L3 is backwards, and it's like a big V wedged into the bone below. And he couldn't stand up straight. He couldn't do anything. He starts getting adjusted. He's feeling better. We get him through a decompression protocol, and it literally, there's space in that area now where it's like decompression pulled the bone out of the other bone for those
Yes.
ordinary human beings that aren't as geeky as us and talking about it, so they
Yeah.
can understand. And you look at it, and he looked at it like, oh my God, I cannot even believe it. No wonder I'm standing up straighter. No wonder I feel regenerated. No wonder I feel taller. No wonder my wife says I'm straighter. No wonder I'm able to do all of these good things. And then we had a woman who, she didn't want to come. Her family made her come. said, Mom, you got to take care of yourself, Mom. You're always taking care of everybody else but you. And she said, all right, leave me alone already. I'll go. And she started getting adjusted. She's feeling better. She gets on a decompression protocol. And her extension, you cannot even believe how the disc has regenerated in her neck. It's like we've never been able to see results like this before. So, you know, like you say, winning combination, it's a fantastic winning combination. And I'm going to go back to the criminality thing for a minute, where you talked about it, and then I'm going to turn it back over to you. You know, if you're listening to this and you have what I call prehistoric beliefs about the things that we're talking about, chiropractic, decompression, nutrition, function, adjusting, all of these things, regeneration. If your beliefs are prehistoric, meaning that you say, well, my great grandfather's grandfather said that you should never go to a chiropractor, or you should never, that is prehistoric. Literally, you are a prehistoric creature. It's time for you to wake up and become present day, because the reality of these technologies and how it's impacting the quality of people's lives is extraordinary. And you know what, if you're going to live to 70, 80, 90, 100 years old, I'm a grandpa now 4 times over. That's exhausting work, being a grandpa. It's my favorite thing to do, but it's tiring. And thank God I'm healthy. And so if you wait till you degenerate severely and you don't take care of it, you're going to have to climb gigantic mountains to get your health back. So the sooner you start taking care of it, no matter what your age, the better.
Exactly. And that's the thing people often overlook. They think in terms of crisis, right? Like I've got sciatica, or I hurt my back, I can't stand up straight. And they go get a little treatment. They go, oh, hey, I'm better. No, you're not. You basically mitigated the crisis, right? Like you're feeling improvement, but you've got to go back to the very beginning and correct what the primary pain generator is. And once you get that stabilized, now you have to maintain that, because you're not the same person that you were before that, right? And I even get on the table once in a while now because of why? Well, I was in that bad car accident, and thank God I had a car that kept me alive. But can you imagine now, like when I meet people and they hear I'm 65 years old, they look at me and go, what? Like, you don't look 65. I go, well, imagine how I would look, Dr. Eric, if I'd had a surgery in my neck and my back 20 years ago in 2006 when that happened. I probably wouldn't even be practicing.
Yeah.
So I still work 3 days a week in the practice. I do my hill work on Mondays and Fridays, which is why we're talking today on a Friday. And I travel a lot. And I couldn't sit in a plane and fly to South Africa or Europe if my disc was all messed up. I have to take care of myself. So it's not just about getting out of the crisis. It's about correcting and maintaining and keeping your body healthy. Just like you said, it's a full lifestyle. If you want to make it to 100, you got to stop taking drugs.
Yeah. And you want to get there healthy, not dependent. And it's interesting because we have the 100-year lifestyle continuum, the lifestyle care continuum that all of our doctors use and teach to help people understand how to live their ideal 100-year lifestyle. And on there's the 3 categories, really 4. There's crisis care, which is when you need it. Then there's the critical transition, we call it, to lifestyle care and performance-based care, that piece that most people drop or don't do at all, skip over or ignore, is the critical transition to lifestyle care and performance-based care. And why we call it a critical transition is because if you just do the crisis care, your symptoms go away or they go partially away, and then you stop and it goes back to deteriorating again. So you're on this vicious roller coaster of degeneration. It's like a cycle of degeneration, living from crisis to crisis. But if you're willing to take the time to make that critical transition from crisis care to lifestyle care and performance-based care, that is the game changer, because that's where the regeneration happens, in that critical transition. And we tell people all the time, it's staying consistent regardless of how you feel so your body can change. And when it comes, that's what regeneration is. And, you know, there's a process. I want to shift with this, where we are now, to the arthritis piece of this, not just the herniated, ruptured, or swollen, bulging disc, but the arthritis piece, which we're seeing fantastic results. And, you know, degeneration and arthritis, I hate the name degenerative joint disease, which is osteoarthritis, because degeneration is not a disease. Degeneration is degeneration. And if it can degenerate, it can regenerate if you remove the cause of the degeneration, which is what
Exactly.
chiropractic care and this decompression, non-surgical decompression does. So talk to us about maybe the process of osteogenesis, big word of how the body will remodel itself if you align it and you get it functioning properly again during this critical transition.
Yeah, so there's one of the first things we learn in school is about Wolff's Law, right? That calcification of a bone or solidification of that bone tissue happens in the lines of greatest stress, right? That's why when you have a fracture, they put pressure on it and they cast it because you want that bone to grow back. Well, Wolff's Law actually plays out when a chiropractor examines you, because if they x-ray your spine and they see a disc that is degenerated, and then they see these like beaks growing out, right? They call that osteophytes, right? Or modic change. Well, what is that actually telling you? It's telling you a physiological story. That disc is shrinking, and as it shrinks, it's bulging out, and the body can know that, senses that, and it starts growing these lips or beaks, almost like it's trying to capture that disc to keep it in, because it knows the disc is supposed to be back here, not out there. So if the body can read that, how much more can it read? Okay, we've taken away that pressure, we've rehydrated that disc, we've increased that disc space. The body no longer needs to lay down that calcification in that tissue. So you can actually undo that physiological process. And what always cracks me up is a patient will come in with imaging and they say, "Oh, my doctor says it's my age." You know, they're 60 or 70. And you look at their spine and there's like all the vertebrae look okay except for these one or two, right? And my first question is I go, "Did you have two births?" And they go, "Well, what do you mean?" I go, "Well, all these bones are the same age, right?" Mm-hmm. "Well, why do these two look like you're 80 and the rest of them look like you're 40 or 50, even though you're 60?" Like, it has nothing to do with age. This is a physiological process that can be altered. And that's where I think patients start to go, huh, I thought it was my age.
Yeah, I love that. And I have that conversation all the time. So we are so aligned in our communication. I got to tell you, we have x-rays, a poster that we show people, how are you aging? And what's interesting is like my neck right now, my cervical spine looks like a 20-year-old. I have pictures of at 63, I'm 63, of my cervical spine with a perfect cervical curve, near perfect cervical curve. And I have had whiplashes. When I was in college, I was run over by a jet ski, hit me in the head
Oh,
at 20 miles an hour. And I almost drowned. It was a terrible story. But you know what?
jeez.
That's just one of the organized football since I'm a very young age. But why is my neck not degenerated? Because I have had chiropractic care since I'm 15. And I got to tell you, if you're listening to this, the lie about chiropractic, one of the biggest lies is that if you get adjusted on a regular basis, it's going to cause degeneration. I have been adjusted every week or checked every week by a chiropractor probably since I'm 15 for performance-based care. Sometimes I need adjusting, sometimes I don't, but I get checked on a regular basis. I have zero, as in zero degeneration in my neck. My neck looks just like my 33-year-old son who's been adjusted since he's born. And then I have people where I show their x-rays where they're my age and they look 90 and 100 years old and we're the same age. And they have had no adjusting, no alignment, no balance, no restoring of function. And they're the ones with the degeneration, not me. And I'm not laughing at them. I'm laughing at
No.
the lies that are been sold to people for so long. And so what you're saying about the osteophytes and all of that, I have this theory that I don't know if it'll ever be proven true, but I know it's true. You ready?
Yep, I'm ready.
Those people where you see the degeneration, if they were getting adjusted and decompressed on a regular basis, starting even at 60, because of the body and Wolff's Law of physiology and osteogenesis, like we talked about, if they lived to 140, they would all be perfect again if they kept it aligned and balanced, because the body would remodel itself back.
Oh, I believe that.
Yeah. And it's not, so it's interesting. So because the body is regenerating all the time, the bones are regenerating all the time. When we see that, the other side calls it degeneration. I don't think that's what it is. I say it's functional regeneration. There's functional regeneration and protective regeneration.
Correct.
And when you see those bones growing together like that, it is protective regeneration that decompression, chiropractic care can reverse.
100%. And there's studies that show that. And I like your idea of if the person lived long enough, I think you would see a lot of that transition. The problem is so many patients wait too long to get to the chiropractor to resolve these things because of all the nonsense they've been hearing, right? And this is really the biggest struggle I've had since 1984 communicating with patients is trying to sort of deprogram them from what they've been hearing their whole life about how I'm going to put a chemical that's dangerous that has to be prescribed in my body and somehow that's going to make me healthy. Excuse me? Um, and that's going to fix a biomechanical problem. Well, that doesn't make any sense. I mean, it's just the logic of it. And unfortunately, the medical profession at large, and granted, I have a lot of friends that are neurosurgeons, orthopedic surgeons, PTs. These are my friends.
Yeah,
But
absolutely.
they've captured the vision that a lot of the things that they've been told or taught in school really don't add up. And when you start looking at the research and all the evidence out there, it's like, come on, guys, stop working for pharma and pitching this stuff because the the surgical supply company needs to make a profit. Let's do what's best for the patient. And when you capture those doctors and they get it, when they finally their eyes are open, so to speak, they understand it and they believe it too. It's not just chiropractors that believe it. The scientists believe it. But you've got to get past that whole what I call the cultural moral authority that the medical doctor has somehow gained over the years that, if they tell the patient this, it doesn't come out here the other side, it sticks.
Well, I think more and more people, what I love about this is more and more people are starting to think and they're starting to see. So, what has been great with people understanding the reality of the 100-year lifestyle and their longevity potential, it's on every single corner in every community in assisted living centers on every corner. And you see them and these places, they're filled with beautiful souls who had no idea they were going to live this long. So they
Mhm.
didn't know how to take care of themselves to ensure quality of life as they age. They lived the 60-year rot away for decades lifestyle. And we are seeing this generation who has followed the path of the allopath. And because of that, they're on their Sunday, Monday, Tuesday, Wednesday pill box filled with all these different medications that are not solving any problems. They're just changing the physiology of the body. Everything that you and I have talked about today so far, that we're talking about science, research, current stuff, is in all the textbooks today that have not been read maybe by some of the allopaths in a very long time, or they're not being taught by pharma or TV ads out in the world on a regular basis. But if we just open our eyes and look and say, okay, if I do that, I'm going to end up there, then I ought to do this and go in a different direction. So more and more people are taking the responsibility to move from this crisis care through this critical transition to lifestyle care and performance-based care so they can function at a high level for a lifetime.
Yeah, I think that pretty much nails it. And I think, not to get political or, theoretical, but I think the COVID whole thing kind of opened a lot of people's eyes because what were we told? Hey, masks work. Well, no, they didn't. Distance works. They came up with the number 6 feet. They came up with a vaccine that was clearly unproven. And now we're seeing the ramifications of all those decisions. And I have patients every day now, more and more coming to me almost in a primary care role because they don't trust their doctor. I mean, if you look at it on the face of it, even in our society now, at least in the United States, is there's a very low respect or authority now that people trust what their doctor said. They're going to go home and AI it. And now medical doctors aren't prepared because the patients come in, they're prepared with questions, and they're like, whoa, wait a minute. You're supposed to do what I tell you, not ask questions.
Yeah, and I, while they may hate when that happens, I love when that
I
happens.
encourage it
Yeah, me
100%.
too. Yeah, because
Yeah.
it's funny because we've been doing this the same amount of time, pretty much, and we have never had to change our story. It's like every single day we get proven more right that our philosophy, our theories, our science, what we've been saying is real and true and right on. And so it's kind of great to be validated. And when COVID hit, if you think about it, when I was in 1985, there had this quack watch list, and there was so many attacks against, like, vicious lying attacks against the chiropractic industry and chiropractors. And I remember I got on a quack watch list early on because I was telling people that their body had the ability to heal itself
Right.
and function normally.
Like that's novel, right?
Right, right. And so, but I was just vocal about it in my area. So, I got labeled, and I really didn't care because I was helping a lot of people, and I knew I was doing the right thing. But what was interesting is that we, in 2020, we were labeled, we went from cultural quacks, so to speak, to legally essential healthcare
Yeah.
providers,
Yeah. Don't you
labeled
love that?
essential healthcare providers. And so I think about that. 1895 is when the D.D. Palmer gave the first adjustment, and it took till 2020, like 125 years, to get the validation that we didn't need but deserved. And
Correct.
and the reason why we never wavered, I think, at least from my perspective, is chiropractic has been a grassroots movement from day one. From day
Hmm.
one, and it's still a grassroots movement, teaching the people that the body has the ability to heal itself and function normally if there's no interference. And that's truly the 100-year lifestyle way. And so, talk about if a doctor or if a patient wants to, let's start with the patient. If a person wants to find somebody where they can get an evaluation and decompression, where would you tell them to go? I know if you're anywhere near the Atlanta area, you can come to us. We have people that come from all over the country, even worldwide, but you're welcome to come to us, where our office is in Marietta, Georgia. It's 100-Year Lifestyle headquarters, and we do have a map of our 100-Year Lifestyle certified offices. But you also have a map. That is, you've been doing this, I think, even longer than we have, and you have your equipment in a lot of places. How do people find a provider that is doing chiropractic and using your table?
So our website is hilldtsolutions.com. And when you click on that, it'll pull up a homepage. On that homepage is we have it right there, find a doc. And you can scroll through and it shows the whole world. And you can pick anybody in the world. And if they've been certified and approved by our organization, then we know you're good to go. I would first suggest we'll go to the 100-Year Lifestyle website and find doctors that you have confidence in that know how to help people get that. And then if they don't have decompression or are looking to get it, then they can go onto our website and see if the two correlate. Because I know we do share the same clients that people that are part of your program and people that have our equipment. And those would be the people I would pick. And if you think, an hour or two or three are too far to drive, I've had patients from Africa, from Germany, from all over the place that hear that I'm somehow quote unquote the expert, and then they fly and they stay a couple weeks and we treat them and we get them back on their feet and send them home. And the hard part's what do you do after that? Because then it's harder to find people to do the follow-up care. But I will say this, that network is growing. And I think the difference is medical doctors and all of the word you use, the allopathic solutions, they kind of sell on fear, right? Well, if you don't get this surgery, you're going to be paralyzed, right? But what we sell is hope for a better future and hope for a better outcome.
Yeah, it's interesting. And, that scare care is what I call it, that scare care. What's interesting about the 100-Year Lifestyle is the other side, they will scare people into doing something because, if you don't do this, you're going to die. And we're like, no, 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 you're going to live. And they're like, holy crap, that scares the crap out of me because if I feel like this, I don't want to live like this. And so it can be scary either way, but the hope and the reality of, listen, these people that are 80, 90, 100 years old today, none of them plan to live this long. You have to understand that. That is like a core understanding of the 100-Year Lifestyle, is this is the accidental centenarian generation. They have outlived their life expectancy when they were born was only 50 years. This is a
Mhm.
generation that has outlived their scientifically predicted life expectancy by 5 decades. That is an insane statistic. And so we don't know if you go to 100yearlifestyle.com, you could actually calculate your innate potential or your life expectancy potential based on your family history. It's on the homepage of the site. And it's called your minimum potential years remaining. And the thing is that the minimum, whatever the minimum number is, that is not the maximum.
Right.
Nobody knows what the maximum is. The minimum potential
Right.
years remaining in my family, my father died at 76 or something like that, 78. My mother, and he rotted away in a home for a decade. God rest his soul today. He basically, his brain got destroyed by long-term statin drug use, and he ended up with a statin-induced dementia, which is terrible. And he didn't know his grandparents, and he didn't know his kids. He didn't know his wife of 44 years. It was heart-wrenching. And he didn't know he was going to live this long. And so he started following that allopath. And then, so he's the oldest one in my family that ever lived or is still living. And so I look at that and I say, well, I'm 63. He had a heart attack at 49. I didn't have a heart attack at 49. He had it at 60, whatever. He lived to 76. Maybe his potential would have been 80, 90, 100. Nobody knows what it is. When we have some people, they do that calculation and they get the number minus 13, which means they've already outlived the oldest person in their family history by 13 years.
Yeah.
And so I think it's time to get hopeful, Dr. Tim, with what you're doing over there, helping people regenerate at HillDT, non-surgical spinal decompression. If you're a doctor listening to this, go get a table or two. We have doctors that are friends of ours and 100-Year Lifestyle people. They got one, then they got another one because they just filled it up with people that wanted to regenerate in this way, and they're doing fantastic. If you're a human, earthling, ordinary person, give it a shot. Give yourself a chance to regenerate. It's really amazing. And we can't leave without talking about the brain here for a minute. Sorry, we got to do this. We got to talk about the brain.
100%.
The cervical decompression protocol. We have people telling us that their brain is healing, like literally brain fog going away. They feel like that the brain is getting washed because of the cerebrospinal fluid flow. They don't know that's why. We tell them that's why, but we adjust them and it frees up the cerebrospinal fluid, and then the decompression, literally it opens up like a pump, the nourishing and cleansing of the brain, better focus, sleeping better, allergies going away, brain fog going away, clarity, vision clearing up, like all kinds of amazing things. Talk about why and how that happens.
So my opinion on that is basically based on what the research has shown, right? We understand that cerebral spinal fluid sort of has its own pulse, right? And if you think of it this way, I think for the patients out there, especially, the best analogy I can give you is think of a pond that you have in your backyard that now, for whatever reason, something blocked that little drain or that stream that kind of flowed out of it. Well, what happens to the pond? It starts to turn green. You get algae buildup because it turns into a cesspool, right? It's just a collection point for things and it can't flow. Now imagine that having a big bucket of a backloader scraping that opening again, and you get that flow. If it's water flowing in and water flowing out, how long does it take to really clean that out? Well, it's almost immediate. You get all the nonsense that's collected in there flowing out. So as you open up the spine and you create more space in between the discs and the openings of the foramen magnum and where not getting too technical with the anatomy, but as you open up all those spinal structures and you get that free flow going again, the brain can actually now sort of get a cleanse effect in the sense that the fluid is moving again. And that's just another way of saying it gets stagnant in there. And that can't be good for your physiology in any way.
So you mean it cures algae brain?
Yeah, there you go.
There you go.
Is there a CPT code for that yet?
I don't know. I don't know if there is, but I do believe that that's true. And I got to share two quick stories about this because it just was mind-boggling to me. We had a woman, she came in, she had a brain tumor like 12 years before. And she had multiple surgeries, 4 or 5 surgeries. And she came in because she was having headaches and she was having paresthesia or numbness, tingling in her arms and hands. And she was not able to move her neck really well at all. We took an x-ray and she had a reverse curve in her neck. Everybody listening should go to a chiropractor and get an x-ray of the curve in your neck to see what it's like. Everyone. And so you see the reverse cervical curve on this woman, and she's got degeneration there. So Dr. Corey, he gives her first adjustment, and she literally, you got to watch the video if you're just listening to the audio, because I'm going to make funny faces now. They're not really funny faces, but this was her reaction. You ready? She was like, and she was like spitting in her mouth. Oh and we were like, Dr. Corey's freaking out a little bit. He had never seen that before. I had never seen that before. And I'm like, oh my God, are you okay? And what she said to me totally blew my mind and changed my life. She said to me, I feel like all of the anesthesia and the drugs that I've been taking for years now, since I had this brain surgery, just dumped into my sinuses and into my mouth.
Wow.
And I was like, wow, it's exactly what I said. Wow, I have never heard that before. That is amazing. And so, I mean, that's real deal. Cerebrospinal fluid is real deal stuff. And then it happened again with another person, except she didn't dump into her mouth the chemicals. She was like, oh my God. And she just grabbed her head. And I was like, oh, you okay? And I adjusted her. She's like, oh my God. I said, what happened? She said to me, I feel like a tidal wave, a tsunami just went into my brain. And I said, wow, that's amazing. And this woman, so the first one, sensitivity to light went away, paresthesia went away, doing amazing right now, fantastic. And the second woman, she had a blind spot after the brain surgeries, and the blind spot got smaller and moved.
Wow.
And because we adjusted her neck and we got that cerebrospinal fluid flowing based on everything we've talked about, decompressing her spine and her brain. And then she asked me a question that I don't have the answer to, but it's a great question. And it's a question that a chiropractor would ask. She asked me, and she was doing amazing. No more headaches, back playing tennis all the time, doing fantastic. She asked me, Dr. Plasker, I have to ask you this. Do you think that reverse curve and that degeneration in my neck could have caused the tumor or contributed to the tumor? And I said, wow, that is an amazing question. That in my gut feeling, I would say yes. I haven't seen the research yet, but you know what? I think you should trust yourself that that's probably true. And so, we're talking about, Tim, really cutting edge common sense stuff. Can it be cutting edge and common sense at the same time? Absolutely. And so, this has been fun. We're going to do a lot of this kind of stuff. You having a good time?
Oh, I'm looking forward to it. I've been accused that I could talk about decompression and break a filibuster in Congress.
Well, maybe we need you to do that and get some change going there. So
yeah, it might help, huh?
Yeah. Leave us with a closing thought, my friend. And I'm excited about the future that we're doing together. Proud to have you as a 100-year lifestyle certified company. You've earned it. Are you doing a great job for humanity and helping people live better, longer, live their ideal 100-year lifestyle? Leave us with a closing thought.
I think the best thought that I can leave with people is if you're looking for answers, don't quit till you find what you feel in your heart makes sense to you, and never make a decision based on fear. Because if you're being driven to an answer and you're fearful about what to do and what the outcome is, then it's probably not the right answer. It has to resonate with what you feel is best, and it has to offer hope, true hope, not we're going to go from worse to maybe a little better. There has to be a real answer. So that would be what I would encourage people that are listening to think about, because so often people make decisions and I hear it every day in my office, man, I wish I would have found you first.
Well, you've been found, Dr. Tim, and for all of you that are listening and for all of you that have family, friends, coworkers, share this with them and let them understand that there is hope for them, that they're probably going to live longer than they ever thought, whether they like it or not, want to or not. You can have an opinion about it. It's still the United States of America, at least where I live. We'll see. We'll see what happens down the road in this crazy, insane world that we're living in. But I got to tell you, it is true that you have an innate intelligence that has the blueprint to live to 100 years and beyond healthy if you take care of it the right way. So welcome to the world of the 100-year lifestyle. If you knew you'd live to 100, how would you change your life today? Now's the time, everybody. Appreciate you being here. Go visit our website, 100yearlifestyle.com. Go to HillDTsolutions.com. That's correct, right? HillDTsolutions.com. Learn more. Take care of your brain. Take care of your spine. Take care of your nervous system. And we'll see you down the road somewhere. And thanks for watching and listening.